And while Australia has largely managed to contain COVID-19 so far, its second most populous state, Victoria, has reported its first COVID-19 case in nearly 2 months. Now, the authorities are scrambling to find the source of the infection amid concern about a new outbreak. This comes after Australia announced its borders will remain closed to the rest of the world for an indefinite time period. A man in his 30s who returned from India in mid-April and completed mandatory 2-week hotel quarantine in South Australia tested positive after he developed symptoms over the weekend. Though Australia has largely eradicated the virus with border closures, Victoria has had most of the coronavirus cases and deaths and spent much of 2020 in a lockdown.
This morning, the Department of Health was alerted to a positive COVID-19 test result and immediately initiated a full public health response. This is what we know about the case so far. The individual is a male in his 30s. He recently returned to Australia from overseas on the 19th of April. He undertook hotel quarantine in South Australia.
The Australian borders were slammed shut last year in March as the coronavirus cases spread across the world. Only citizens and permanent residents were allowed to travel to the country. Nearly 30,000 COVID-19 cases have been reported in Australia, with 910 fatalities. More than 2.5 million Australians have so far received their first jab. However, the government has received criticism for its slow rollout, falling well below its target of having 4 million adults vaccinated by the end of March. WION is now available in your country. Download the app now. Get all the news on the move.